Major changes to your insurance took effect today, but it's making a lot of people wonder, what will this do to my coverage or my costs? Amy Hawley has the story.
The next time you renew your insurance, you'll see some changes. Your child will now be able to stay on your insurance until the age of 26, and insurance companies will no longer be able to deny coverage to children up to 19 years old with pre-existing conditions. Those are just a few of them. They sound great, but guess who's about to pay for the new mandated benefits? You, particularly the small business employer and employee.
One thing's for sure about the coming changes in the government's new health care reform plan.
We don't know.
To be determined by HHS. That's what it says.
The unknowns are what make both employers and employees the most nervous about what's to come.
They've asked their boss, can you assure me that when Obamacare is fully implemented that I will, one, be able to keep my insurance that I have now, and two, that my premiums will not have gone up? Can you assure me those two things?
The answer changes depending on who you ask.
You may get sick. You may wind up having a health condition. Well, now you're going to be protected.
Starting in 2014, insurance companies will no longer be able to deny anyone for pre-existing conditions.
That sounds like a good idea, but what that does is it raises rates substantially because now we take the very unhealthy people and have to take them. So I have to assume you're only going to get a policy when you're sick. So now rates go way up for everyone.
Insurance companies agree with both sides.
More people getting more care is driving up the costs. This reform bill addressed getting more people coverage. It didn't address making it less expensive.
It's why companies, particularly small businesses, are searching for solutions to drive down costs on their own.
They're the ones most likely having difficulty paying for health care coverage.
Come 2014, businesses with 50 full-time employees or more will be mandated to offer health insurance with no more than a $2,000 deductible or face fines. But the solutions to bring down costs may not be in an employee's favor. To survive, businesses already have suggested reducing their workforce to under 50 people, or reducing full-time hours, or paying the penalty and offering no insurance, or saying the employee has to pick up a bigger percentage.
Healthier employees are more productive. Good, now let the knee follow the hand on the way down.
Or if you work for someone like Matt Condon, an athletic and rehabilitation specialist, you're encouraged to get healthy.
Showed them our wellness programming and said, this is what we're doing, and we're not going to take this increase. And if you, our insurance company, won't do something about that, we're going to open it up to the free market and see if a different insurance company will. Our insurance company came back, lowered our premium increase $28,000.
His wellness programs have saved his productive employees money and companies like MoDOT too. The state's transportation department has saved $7 million in health care costs in just 3 years' time.
Amy Hawley, NBC Action News.